All right. Hello, everyone. My name is Gwendolyn Bork. I am the president of Focus for our community, unity and support. And this is our Addiction Prevention 101 series. For this month, we're focusing on planning part two. So if you haven't seen planning part one, I suggest going back and watching that. It gives you a good foundation into kind of the nitty gritty of what we're looking at today. So last month, we talked about the fundamental components of what we need to take into consideration before we actually start the planning process. Now, this segment today is strictly about the plan. We'll call it the top view to the very lower level, the bottom view of how we organize this 12-month action plan that has to be submitted on an annual basis to the White House Office of Drug Control Policy and monitored by the CDC, and how we take that, extract that plan that gets approved, and mobilize it. I mean, in that year, and check off those action items to be effective in our planning process, evaluate what works, what doesn't work. And evaluation is actually a component of this series that we're going to talk about actually after all of this planning information. So what I want to show you, I'm going to show you my screen. I'm going to show you some of the things that I have to do. So first off is, nope, that's not it. Hold on, new share. Where is it? This is it right here. So on an annual basis, the grant that we applied for originally that we were awarded, this is the main bulk of our work. This is the way that they outlined it, and we had to follow their format. They know that these are evidence-based, data-driven strategies. So when I submit my action plan on an annual basis, it turns into, about 3 pages, and this is just for the year. And from these 3 pages, I extract the main points. I put them into a simplified version. But this is what we're trying to do. We look at the 2 main goals of what our coalition is meant to achieve. And one is to increase community collaboration. That is always the goal. That's part of the grant for to be a drug-free community, is to have collaboration, because you can't do things on an island by yourself. You need partners. You need people that have expertise and resources from within, their particular sector of the community or business. And we utilize these people's resources, time, resources, whatever that may be, expertise, to be effective. So the goal there's 2 out of 2 goals for what we have to achieve on an annual basis to report back to the federal government as being effective. First goal, increase community collaboration. That's always number 1. Second goal is to reduce youth substance abuse. So those are the 2 goals. That is how we're evaluated on an annual basis as being effective and using the money that really the public gives the federal government and the government uses to grant out organizations like us and keep us accountable and responsible for those funds. So for increasing community collaboration, this was written obviously last year. It was created and confirmed and approved before January 1st of 2022. We always have a goal of increasing parent engagement. Parents aren't always involved, and some parents don't always have time. So some of the parents that do get involved don't always stay. Life happens, right? When you're parents, that's family, and family comes first. So the goal is, we have a constant goal of always bringing parents to the table. And our goal for this year was to increase parental engagement. So out of all the 12 sectors that we've talked about that comprise of a community, parents hold a seat at that community table in that sector. Parents have their own sector. So the goal is to get 2 more parents sitting at that seat by the end of the year. So how are we going to do that? Obviously, they need to know about us. If they don't know about us, how are they going to sit at the table? So first strategy of that objective to the goal is to provide information to the parents about us. So the freshman mandatory, forums that they have to go to, the freshman seminars, Whether it's we utilize our partners, so whether it's Erie County Prevention Council or Kids Escaping Drugs, whoever gets the contract with the school that year to run out the prevention programs and talk about that, they either pass out information about focus, they talk about focus in their PowerPoint if it's a virtual presentation, and we're that local resource then to them where parents can get involved. So that's one way, right? Well, we so our objective then, this is part of this planning process, is what is the activity to back up that strategy? We're going to present at the ninth grade parent forums. These are the sectors that could be responsible, or the people that could be responsible. It's due by this day. And then the thing that also another activity that we could do to this strategy to provide information to the parents is to have a table at the open houses during the beginning of school. So we were able to do that 2 years ago. Last year, we were hoping to be able to do that. We were only, with COVID, we were only able to get access into, I think it was Depew. So that because of not having access, that has it hurts our ability, right, to be able to get the parents. But that was an activity to give us the face to the organization, to be able to meet with the parents, the people that we really need. Another activity is to present data that we collect. So all the research, all the surveys that we do that are done by someone who is a federally approved evaluator. That is part of our grant. We have to hire this person as a subcontractor to present the data, and that data is community data. So, let's get it out there to the community. So we do a town hall every year. Lately, it's been a virtual town hall because of COVID. And then that's due dates there. Promote the event and information with the help of the sector. So sometimes if one activity is just one activity, there's other action items that have the due dates before that in order for it to be effective. If we're going to present data at a town hall to the parents of the community, by December 30th of 2022, well, we have to promote the event with the information and all the information with the help of everyone else by obviously the end of November. So the planning starts before November, and that's due by the end of November so that we can get people in the seats by the event, which also has to be done by December 30th, 2022. So these are, just examples. Another activity is to increase the youth engagement by 2 youth. We just want 2 youth at the table. Again, this is a hard thing to do when youth are under a lot of stress. COVID has not helped their ability to, juggle activities when life is just harder, and it's still not back to normal for these kids in school. So some of the youth that we had sitting at the table, they're just trying to hang on right now, hang on to their grades, hang on to their mental health, their family, their friends, that fundamental structure. So we just need 2 more by the end of the year, right? So that's our goal, or that's our objective under this goal of increasing community collaboration. From there, what is the strategy? We need to get to the youth, right? So where did we normally do it? Inside the school at a health and wellness fair. The first one that we did a couple of years ago at Depew, Cayuga Heights, super successful. Over 100 people attended. I think it was a couple hundred actually. We had clickers. We were, checking who was adult, who was kids. Lots of kids, lots of awareness. Lately, we've had to do it virtually, but we have included the kids, the students from Depew High School Academy of Finance, to help create some of the fun videos and the fun things that are part of the Health and Wellness Fair to get them engaged and get them to know about who we are. But as you can see, well, if we were going to have a Health and Wellness Fair, we need to market it. We need to invite participants, and then we have to implement the Health and Wellness Fair. So all those, again, have the dates. And we have other strategies, right, of recruiting youth to the coalition by having some sort of a recruit event, bring a friend type thing, escape rooms, whatever. We're working on that this year. We have our next one is coming up in March, and we have 18 people. 2 rooms is 8 people per room. No, we have 16. So we have those 2 rooms now, and they had to be accompanied by a parent. It's the escape room at Galleria Mall. So we've got 8 parents, Depew Lancaster parents, 8 students, Depew Lancaster students. He's our prime audience. Free event for the parents and the kids. But hey, spend an hour with us. We'll feed you. Let's talk a little bit, tell you about who we are, how you can help us, and how you can get engaged. So that's another one. But this is like, that's how it works, right? Even then, and then if you're looking at reducing at the second goal of reducing youth substance use. Well, we know based on our data that was done by the Prevention Needs Assessment Survey that we want to measure those same 30-day usages, 30-day usage, past 30-day usage of alcohol with the students, grades 8 through 12. We want to look at that data that it was done in 2019. Then we're going to look at the next set of data and we're going to measure, okay, can we reduce past 30-day usage of alcohol by 2%? How are we going to do that? We're going to provide support by creating opportunities for these youth for alternative alcohol-free activities. It's an opportunity for pro-social involvement. Aside from the escape rooms, our big annual event is Glow Fest last year, super successful. But what do we got to do? We got to plan for it. And then we have to implement it, right? So we want to be at Fall Fest, the Erie County Fall Fest, and get the youth engaged in that, help us out. Maybe run little scavenger hunts for the younger kids, which we did a couple years ago. Just by pro-social involvement in drug-free activities, these youth get involved. That's one less day, one last time that majority of them would, behave and actually use these drugs that we are focusing on, alcohol and marijuana. Another thing would be to like, hey, what's happening with the whole Fireball and malt liquor, so-called malt liquors that are super high alcohol content that are now at your grocery stores or 7-Elevens right at the cashier's desk or tucked around a corner that kids can just pocket and take off the shelf. And that obviously that could potentially be a problem. So what are we going to do? We're going to create a committee. We're going to see who's selling what, where are they selling it? We're going to talk to the people, the head up people, the managers of these stores, find out what they're doing, what they found, that is effective to keep this out of the hands of the youth. And then see if we can share that information and maybe make it a little less harder for these youth to get access on it. So that's one way. We're going to develop educational campaigns about the dangers of some of the marijuana on the street, how potent it is, the level of THC versus what it is now versus what it was, and implement those, via social media marketing, educational campaigns, one directed to the youth, one directed to the parents, different messages, same intent to provide information. So these are all, surveys, taking surveys, this year we're going to be doing focus groups to kind of dive down deeper into the data that we collected and decide, all right, what is the actual specifics of, so we know that you're using over the past 30 days, X amount percentage of these youth are, well, where are you using? Why are you, these are the focus groups that are going to happen over coming into 2022. So what we need to do is continue. So I take all of this and then I simplify it and I present that at all of my meetings. So every time you attend a meeting and you look at the goals and the strategies, there's every time I either print it or if it's a virtual meeting, it's accessible. And this is all that broken down into a one-page simplified version. These are the objectives. These are the strategies. And this is our action plan. These are like the top things that need to be done by their deadlines. So when I share this with my coalition, they know exactly, okay, the music festival, that Glow Fest, it's got to be done by August 31st. The health and wellness fair by October 30th. Those are the deadlines. And then from there, we separate it even further. And one of those particular things that I do is I take it down. Where is it? Is it here? Okay. I'm going to show you this PDF. So I create more or less like subcommittees, right? And some of these committees have to do with that. So if we're going to do this, marijuana educational campaign, all right, we're going to need, Deb LeBounty, our mental health counselor for Spectrum Health. We're going to need, some influencers, maybe that work with the youth, like Eileen Cartonia from Topeka High School. Excuse me 1 second, please. And the SAD club teacher, Leo Cintron, they know, okay, this is what needs to be done. Those are the deadlines. And then from there, we take the abstract of the information that is there And then I simplified even more by saying, all right, this is our timeline. This is what needs to get done. And this is what I'll need really your help having focus with the youth by these dates, right? So we have part of the objectives on the grant. We have the abstract, what we're trying to do, kind of an overview. And then this is like more the timeline. All right, this is where we got to start it. This is what we're going to start doing. And then this is how we're going to apply, these data points and implement them by this time, right? So in the end of this little educational campaign, that's going to start kind of right now, but really go into full effect by September of this year. At the end of this, by November 1st, we'll have a full-scale educational campaign, 10 digital flyers for the youth audience and 3 one-minute infomercials about the information that we're trying to reveal. Same thing for the parents. All these things have to be submitted by this date so that I can launch on this date and print platforms by these dates. And it's all right there, right? So anybody who wants to get involved, there's the people, there's the members, and then this is where you can provide assistance, right? And I would say the last one that I would say that I've recently done, which has a more broader range because it has a lot to do with a lot of the pieces of these action plan, is like fundraising goals. We want to be sustainable at the end of this grant. We need to have that foundation that we're building right now be built to, at least 100K. 20K a year was the goal for this 5-year grant. We're 1 year behind because of COVID and not having access and not being able to do events, not be able to do really anything, right? So I've got my chairman, John Brusso, is also my program director, my co-chair, Audrey Hammerneck. I have members of the coalition and members of these that have worked with us before that take on certain pieces of this, and then they can go out and delegate, implement, and they have the authority to do so on behalf of Focus. Here's the outline. They know exactly what we need. These are our fundraising areas. This is the potential revenue if we meet all the goals. And this is the action plan. This is our action plan for virtual raffles, quarterly in-person events, spring and fall fest for the community leaders in our community, the summer glow fest, our goal for legacy partners to help, again, there's only one source to help maybe build that, the Focus partnership, the legacy partners and the foundation, what that, like monthly donors, community creators, I call them, right? Like what that could look like. And then if we sell some shirts and stuff, right? So that's, when we break it down, I've realized and we've seen that it allows the goals that are written down on the actual, on paper, the very things that the federal government is expecting me to carry out, expecting Focus, I should say, to carry out. I break it down into bite-sized pieces for the committees to then go and implement it however they wish, whoever they need to connect to. And then I'm just the facilitator. I help facilitate. They use our technology. They use our database. They use whatever they need to help carry out these goals. And that's how we work together. So a lot of that work, the planning is broken into pieces and the main chunks are there. The bigger pieces are there with the goals and the timelines and the objective that have to be abided by the grant. But when it comes to the day-to-day, the little pieces, the broader things of all the little mini steps that it takes to get to a successful event or a successful campaign, that happens with these committees of these people that check in once a month at our monthly meetings. So the work that we do is outside of our monthly meetings. That is emails, phone calls, popping in, on our trip home, to a potential business or whatever. So it happens kind of in the background with intention, and we're able to get a lot done, because of that. So that's a more defined look into how we break apart the actual action plan that's submitted to the CDC and how it is broken down even further in order to be that person kind of coming in and wants to get involved. Yeah, where can I go? There you go. Here's our goal. Instead of trying to explain it every time, this is it. This is what we got. Where do you want to fit in? Where would you like to be? And the more hands, is less work. So I appreciate all of you who took this opportunity today to get informed on our process. We know it's effective. We know that it works. We appreciate the people that do stand by us. And we're looking forward to, seeing everybody this year as we implement this plan that we have and become successful even more so at reducing youth substance use in our community. So thank you very much. This is Gwendolyn Borg, President of Focus for our community unity and support, the local Lancaster, Depew, New York Addiction Prevention Coalition.